This video is going to be about a full body medical for a ship. So first topic, let's cover where you are going to do your full body medical test or your full body medical checkup. In India, it is going to be a DG approved. We have a ministry, Director General of Shipping of India. They appoints or there are doctors who are approved from a DG shipping. So across the India, there are many doctors who have a license, who are approved by DG shipping. How you're going to find out a DG approved doctor nearby you? Then I will provide a link on the I button here. You can watch that video and you will find out DG approved doctors nearby you. Okay, so you have to go and book an appointment, or you can also go a walk-in. So me, I had taken an appointment into Apollo Clinic in Dehradun, and we have a doctor there who is a DG approved doctor. So I had taken an appointment there, and now let me tell you step by step how does it takes place and what did they check in me. So first of all, they're starting my consultation and the checkup with the eyes. They are going to check if you have a color blindness or not. They're going to check if your eyes are 6 by 6 or not. They are going to check your speech, like basically speech reading. These basic three things are being checked in an eye test. Now second thing is your blood pressure. They will check your blood pressure. Third thing is they are going to measure your height. Fourth thing is they are going to check your vitals. So after this, your blood test and your urine samples are taken. If you are a food handler, they will be asking for a stool test as well. And make sure by the day you are going for a medical test, full body medical test, you are fasting. You should not have any breakfast. You directly should go there a empty stomach. Okay. So after this, they had taken about if I remember correctly, 3 syringes of blood, 1 urine sample, and if you are a food handler, you have to give a stool test as well. Doesn't matter male or female. Okay. In my case, I work in a technical department, so stool test was not included. After this, X-ray was done. So basically they have a machine and you have to do some Shaktiman pose, and they will ask you to stand there. They will ask you to remove all the electronics which you have in your pocket, any chains, any kind of a metal which is like you put in a neck basically. So they will ask you to remove that and you will have your X-ray. Your full chest X-ray is done there. X-ray is very quick, it takes hardly a minute. After the X-ray, they will do your ECG. All your vitals, all the electromagnetic waves, everything is being checked in this ECG. After this, you will have your audiometry test, which is an audio test. They're going to check your ears. So they will ask you to come in a very small and a private room where it is very quiet, and they will ask you to put some kind of headsets. You put them and they have a machine. They are going to create or generate some different type of beeps, different type of beeps in different megahertz. So you'll have to identify in which ear you are you have to recognize by your ear, right or left, and you have to tell them. Okay, this is how it takes place. After this, they are going to check your lungs. So they also check basically if you are suffering or you are nearby to asthma. So they will have some kind of a pipe which you have to blow the air continuously. There are different patterns which they follow. So basically your lungs test is done, and there are some positions or there are some examiners who does that ultrasound as well. So in ultrasound, your lungs, your kidneys, everything basically is being checked. So ultrasound also can happen, depends on the shipping examiner, or it also can be a requirement the ship you are joining. So after this, your physical test is being done. They will ask you to take out all the clothes. So when you take out all the clothes, they are going to check in case you had gone through any surgery, any operation, and they will check if like the basic doctor is going to check your treacheries, your penis, of course. In case you are a female, your private body parts are going to be checked. They will check your butts, everything. This physical consultant or a physical physician, I would say, is going to check basically everything. This can be maybe embarrassing for the first time when you're joining the ship or first time you do it, but me, this is about my 3rd time and I don't really mind that. So once you cleared all these steps, now the last step comes is your vaccines. So basically they will ask you if you have taken any vaccines previously about like tetanus, MMR vaccines, polio vaccines. Basically when we are child, so by the government there are some schemes, so there are some programs are being conducted. So we do get a polio vaccine as well, but in most of the time we do not have a paper of that, and when you're joining a ship it is mandatory to have a certificate or a paper you have taken that. So in my case I did not have that, so I had to take that, but this time I did not take it. This I'm telling you a story when I was doing a medical for the first time. So how many vaccines are you going to take? Vaccines can be a lot now. I'm expecting you have already taken vaccines of COVID, first and second, and booster as well. That is required. Second, your tetanus, of course, then hepatitis, and then there is a cholera vaccine, there is a chickenpox vaccine, there is a polio vaccine, there are MMR shots, 2 MMR vaccines given in the interval of 1 year or 6 months. I don't remember correctly, but yes, I had taken 2 shots of MMR as well. So somehow this is what is going to be your medical, so make sure you are prepared for that. Make sure you clean yourself. You are going for a medical test, that is also important for the hygienes. And yeah, that's all I would say. After this you will be getting your medical. I already have that. If you can see, this is Apollo Clinic medical which I have received. It is about 25 pages, and if you want to find out how much does it cost for a medical, I have paid for the moment about 6,000 rupees for this medical. But yeah, when you're doing for the first time, you have to take many vaccines. It can go up to 10,000 as well, and also depends on a DG shipping examiner how much do they charge. There are many examiners who charge about 4 to 5,000. There are many who charge about 7,000 as well. So it completely depends on the examiner, plus how many vaccines you are going to take for that. Including this, I have forgot to mention one vaccine, which is a yellow fever vaccination. This vaccination is a lifetime vaccination which you must take, and in case you haven't taken that, the shipping examiner will ask you to take that. In case they do not have approval for it, international recognition, whatever institute or whatever, I would say, a hospital they are running. Mostly government hospitals provide this yellow fever vaccination, but there are some private hospitals as well who are recognized by the government and they have international acceptability. So in this case you have to ask them, and most of the case for a shipping they already tell you, so no worries about that. So about 6,000 was my cost. This is my bill, and if you would like to see a little peek about my, this is my medical. So yeah, it depends on a ship you are joining. As per that you will have your format, and first 3 to 5 pages depends on that, and rest all everything like your blood tests, your blood reports are there, your urine reports are there, all the vaccinations are attached here. This is the ECG report, and then last you have your X-ray. So that's how you will get your medical. I hope the information provided into this video was helpful to you. If yes, then please make sure you like this video. If you haven't subscribed, make sure you do subscribe as well. Do share this video with your friends who are participating or practicing or doing a preparation to join the ship. Thank you so much for watching this video. This is Akshay. Goodbye.